Welcome to the Pharmacist Voice Podcast, episode 216. I'm the host, Kim Newlove. Today's guest is Dr. Michele Mosier. Michele is a pharmacist, a patient advocate, and the founder of Hope Health Advocacy, LLC, which you can find at hopehealthadvocacy.com. If you are curious about what a patient advocate is, the type of work they do, the services they offer, how they get paid, and more, stay tuned. You are going to enjoy this episode. If you're new to the Pharmacist Voice podcast, welcome. Again, my name is Kim Newlove and I'm the host. I'm a pharmacist by training, but I'm not in clinical practice anymore. I made a career transition to voice actor and podcast host. Among other things, I narrate audiobooks for women pharmacist authors, provide medical narration to clients in the pharmaceutical, biotech, and continuing medical education industries, and I narrate content for explainer videos and e-learning projects. If you have a project in mind, contact me through my website, thepharmacistvoice.com. How did I get into working in this industry? I was inspired by my nonverbal son who has autism to combine my background as a pharmacist with my speaking voice and launch my business, The Pharmacist Voice, in 2017. My son Craig helped me realize the power of having a voice and using it. My solo podcast episodes are about some aspect of being a pharmacist, a voice actor, a pharmacist podcaster, or my career transition from pharmacist to voice actor and podcast host. My interview shows feature a variety of people who use their voices to advocate for something, educate in some way, or entertain so that you are inspired to use your voice too. This is episode 216, and you can find the show notes on my website, thepharmacistvoice.com. Just click on the podcast tab and search for episode 216. Without further ado, here's my conversation with Dr. Michele Mosier. Hi, Michele. Welcome to the Pharmacist Voice podcast. How are you?
Hi, Kim. I'm doing great. How about yourself?
I'm great. Things are great here in Ohio. You are my neighbor in Pennsylvania.
I am. I live a little bit south of Pittsburgh, and I go actually back and forth between there and Ohio. So I'm very close to you.
Yep, we're neighbors.
Yes, nice.
Well, it's good to have you on the show to talk about patient advocacy. One of my favorite things to talk to people about is how they use their voice to advocate for something, educate in some way, or entertain. Today, we're definitely focusing on advocacy. At this time, I'd love to invite you to talk about how'd you get from Duquesne University all the way to being a patient advocate?
I would love to, Kim. So for about 22 years now, I still have my pharmacist licenses, but I do still have them. But practicing for, I'd say, since I started the business, probably now 20 years ago, I was in this, I felt vicious cycle of not being satisfied with my profession anymore. I felt I was really not helping patients anymore. I did retail for about 10 years and felt like I was ringing the cash register more than using any of my knowledge or really helping anyone. So I thought, okay, let me see what else I can do with this degree, because I, again, was feeling very dissatisfied and that I wasn't helping anyone. And they were in this vicious cycle of treating symptoms and multiple medications and becoming quite toxic on them, to be honest. And so I wasn't feeling like I was helping anyone. So I thought, well, let's see if I can be more clinical. So I went to the clinical realm and I went to work for an insurance plan, PBM, pharmacy benefits manager, for another 10 years. And again, felt very dissatisfied, saw a lot of shortcuts being done. All this time felt that we weren't really, again, helping the patient or the client, or, the member, I guess, in the PBM world, they would be called a member. And really it was always about quantity instead of quality. And I would be that person who would stick up for that member in a big team meeting, understandably saying, hey, this could be our parent or loved one or whatever that we're reviewing this medication for. And so I secretly was advocating, I felt, looking back, doing those roles. So shortly after, like towards the end of my PBM transition, so that was probably about 9 years into it or so, my uncle had a stroke, not only one, but two. And bless him that he has never been married, no children. So I felt compelled, having a medical background of sorts, to be that person who went up to the hospital to see him, to look at the medical records, address issues that would surface, listen to my uncle, make sure his voice was heard and his needs. And again, at that time, I didn't realize it was called patient advocate work. But Kim, I can tell you, out of the 20 years that I did the retail and then the PBM world, it was darn satisfying. I felt like I actually woke up and I felt empowered. Like I felt this energy that I had not felt in the years before. At that point, I said, this is it. This is what I'm meant to do. Very much I was into quality and the patient. And I thought, what better way of doing this? Taking all of my knowledge from 20 plus years and giving it back to the patient in this way. So that's how we got to where we are today.
Awesome. And your company is called Hope Health Advocacy, right?
Yes, it is. And the hope really was, that probably was the most challenging thing, was the business name, honestly, Kim. And I just feel like it was perfect, because a lot of times my clients have almost lost hope, that they are so quote unquote stuck. And so it felt fitting to say that I got you. You're in a safe place. We're going to change the tide. We're going to make it. We're going to change it for you. We're going to be on a different path together. And so I was really happy. And then health was because I truly believe given the right tools and what I can do with someone and walk with them along this journey, that we can, if they've lost sight of health because they're, on all these medications or whatever else, that we can get them back to as ideally as what, as healthy as they can be. So I combined those two, and that's kind of how we landed on the name.
I like the name. Hope is something that patients need, and you're giving it to them when they come to you.
Thank you. Thank you.
Now, being an advocate is not easy. You were talking about when you worked for the PBM, you had this level of empathy that was possibly higher than anybody else in the room. You wanted that patient's story to be really seen and heard and understood so that the correct decision for their health was made. That is not easy to speak up and go against the flow, because a lot of times they're probably going by some sort of a script. If this, then that. So what was that like for you to start being an advocate, even though you were still working for a PBM?
So it was extremely difficult, Kim. During that time, I would, instead of for example, you would have to make sure you got all of someone's clinical information before you would decide a case. Well, there's different levels of effort that you would do to get that additional information. Some folks were just like, oh, I tried, I got a voicemail, and boom, let's decision this case and move it along. Well, here I would take that extra step and try a couple times, or, because really in essence, you were exhausting you only have so many tries with getting a medication covered. So you're already exhausting one of their steps, So I said, again, let's think about if this was our loved one that was getting a prescription coverage for, approval or denial from us, I just think you would maybe do it a little differently. So I still stuck to what I believed in the whole time, despite them wanting you to do more numbers. And at that point I said, I need to decide this is not resonating with me anymore. I have this moral ethical compass, and I'm just saying no to it. I'm saying no to it. And so I just, bowed out and we moved on.
When you become an entrepreneur, you get to call the shots. What's it like now that you're an advocate for your own company? Is it easier than it was when you were with the PBM?
I mean, way easier. I can't even tell you, I do not miss one thing about it. When I did my first client and did the work for the client, my first client did the work, I was inside like so happy that it was just validation for me, Kim, that this is what I'm meant to do. It was, I had never felt that in being a pharmacist ever.
Congratulations on finding where your heart is.
Thank you.
A job that you can put your heart into.
Thank you.
You're welcome. Now, do you work in any sort of a traditional capacity, or are you all in with Hope Health Advocacy?
I am all in with Hope Health Advocacy, and I'm really trying not to give myself an out to go back to that.
It can be hard being a startup, right?
It is very challenging. It definitely is. It is not for the weak. I have found that it tests every bit of you. It pokes at all of your, demons per se. But it's been fantastic that it has allowed me to face those fears, those inner, I will say, demons. I feel it's the devil in a way, but it allows you, it brings them out more, and it enables you to really face them. And I think it's the other side of me coming out of this is just, it's a beautiful thing. It's like, I feel like I'm becoming like this butterfly, from a caterpillar. Like it's been, I can't describe it. It's wonderful.
Yeah, it's been a transition, I'm sure. You grow.
Absolutely.
Now, when did you start this company?
So I started it the middle of last year. I guess it's about a year now since I launched the business. It took a while to create the LLC and get the website the way I wanted it and things. So it's been about a year now.
Now, once you get started, I know I had a certain client in mind. I had an ideal client. I had a service I wanted to provide, and it didn't exactly work out, the first idea that I had. I am just curious, who is your ideal client right now?
Absolutely. So being a pharmacist, obviously trained, and that's what I've done for my whole career. It would be anybody who is struggling with medication, not only what they're actually taking every day, so optimizing that therapy for them, so making sure that their medications are ideal for them and they're needed. I'm very big on less is more with medications. Also, if anybody is struggling with navigating the PBM or insurance world of medication coverage, we all know how confusing that can be. They get a Dear John letter in the mail saying, oh, this isn't covered. And it's very difficult to understand the letter and navigate that system. I've done it for 10 years. So both of those things I would say would be my ideal client is around medication, anything medication related.
Medication, access.
Right. Medication.
Things like that.
To it. Exactly. Right.
All right. Thanks for explaining that. Now, I know I probably should have opened with this, but I've got to ask, what is your definition of being a patient advocate?
Absolutely. No problem. And that I'm so glad you did go back to that, Kim, because I think that's part of the problem is that people don't realize what a patient advocate is and how important a patient advocate is. And that my really philosophy is that I feel that no one should navigate this healthcare system by themselves. That my goal is that someday when you go to a provider's office, they don't just ask you, does your insurance cover this? Because they cover that very early on, but also what patient advocate is representing you today and is working with you. We're a long way from that. but would be really a really neat thing if we could accomplish that someday. But so to answer your question, a patient advocate really is just guiding a patient through the healthcare system maze. It's giving a patient that voice in their care and ensuring that providers hear that voice.
I love the word voice.
Absolutely. That is too fun. I never thought about that. You absolutely do. I love it. And I do have a statistic that's pretty alarming. When I was doing another work project, I stumbled upon that only 12%, this is alarming, of US adults have the actual health literacy to manage the demands of a complex healthcare system. And really, healthcare literacy, what that is just really the ability to find and kind of understand and use health information and services. So I guess another way to say this more simpler is 90%, almost 90%, or 9 out of 10 people struggle with this. So the need for patient advocacy is 100% there. It's just about getting the word out that what a patient advocate is and that you definitely need one in your life at some point when you're navigating this healthcare system.
Pharmacists love numbers, don't they?
We do geek out on that, don't we? Yes.
Yes, but it validates the need for patient advocates, right?
Absolutely, Kim.
Yes. So there's a need for patient advocates. You have an ideal client in mind, but we're both entrepreneurs, Michele. We know that sometimes we start a business, we have a primary service in mind, but then we tend to attract other people. In addition to who your ideal client is, who are you actually seeing as your clients?
Absolutely. I'm so glad you asked. So this actually it's been really wonderful actually to attract other clients as well, because I've always been a constant learner. So, and I believe knowledge is power. So I've thoroughly enjoyed all of this, working with these different clients, but I've actually have received a lot of clients that just really have communication issues. It's really just communication issues, really, when it comes down to it. It's communication issues between the providers not speaking to one another, or the client and the provider not hitting it off for whatever reason. I can certainly share an example of that if you'd like, but I think it's pretty self-explanatory. The other thing is, I just had a client this past week that it wasn't particularly a medication access issue, but it was more a transition from one skilled facility to a more of acute rehab setting. So, and there was some insurance blocks that he wanted me to try to help him navigate through. So, and it was a past an amputation. So there was a lot of things that I learned. It was wonderful. It was very rewarding. So I am getting a lot of not so much medication related things, but I've thoroughly enjoyed every one of them, and I still feel I'm helping people. So as long as I feel like I'm still helping people, we're good.
You're still in the realm of patient advocacy, even though it's not exactly that service you had planned on.
That's right.
Yes. Now, where do you provide your services?
Thank you for asking. So I actually do it remote. Probably 99 upwards of 90% is remote, and which is nice. So I can serve nationwide folks. I can, if they're more local, actually go with them to an appointment, a medical appointment, if they need to, just to be that extra, 4 years or better than 2. Also, again, going back to what a patient advocate does is making sure their voice and their goals are being heard. And it's not just the prescriber saying, boom, you have this scary diagnosis and boom, this is the treatment, because that's what that doctor does for every patient that they get that has that. I can do that, but I can also do, which I've done several calls now remotely, and with COVID, they've had to be creative, there's a lot of things that can be done remote now for that. So I just literally get on the phone with the client and the doctors in the room, and we're all three having a good conversation about their health and what's going on. So I've actually open up conversations to, I've had 3 or 4 doctor calls that have been 45 minutes, hour long. I mean, I can't help but say that if I had not been on that phone, it would have been 15 minutes at most. We know how fast those doctors are. Understandably, they have to be because they have huge numbers, I'm sure, to get through. They're just a victim of the system. Believe me, I get that. I feel that I've really helped open up the communication channels, and they're both more perky, my client as well as the provider, and it drives for better results. I'm pro patient and pro provider.
Have you started working directly with providers yet to help them identify patients who need your service and maybe connect you to them?
So I have, and the last doctor client myself, a phone call ended in the doctor saying, boy, do I wish all of my patients had a patient advocate with them. So it's definitely a beneficial service for, like I said, not only the client, but the provider, because they get the client more engaged. For me, because I have my pharmacist brain as well, I can make sure their medications are optimal, they're being compliant. So that's also pushing for better provider results as well.
I love hearing that your patients are getting healthier outcomes. I mean, really, that's what it's all about.
Thank you. Yes. Yes, it is.
Can you monetize this? Do you monetize it? How do you monetize it?
Absolutely. Thank you for asking, Kim. So I have 3 different ways that clients can get, work with me. The first entry point is a 10-minute, it's called a question and answer, and it's $15. And that's for just really simple questions that maybe a client just has just a really quick thing, like do two medications interact, for example. The second way to get to work with me, it's called a 30-minute action plan call, and that is $100. And we talk for 30 minutes and we discuss what their issue is. And I actually give them step by step on how to get unstuck and to, in air quotes, unstuck. And they will, so that's more for that. I like to do those things. I'm the doer. I'm the DIY, do it myself type person. So they're stuck and they just want, how do I get unstuck? And then the third way to work with me is actually it's being billed hourly, and it is called a one-on-one client, and that is $225 an hour. And that is a premium service. My hands are all on deck. I'm actually doing the steps for them and walking them through each, basically that's someone who really is in a complicated situation. And, and it doesn't even have to be complicated, Kim. It could be someone who they just don't have the time to do the steps. So they would maybe be a do it themselves type person, but they just don't have the time. They're working. And so they just would prefer me doing it.
Okay, thanks for explaining that. And by any chance, are your services covered by insurance?
A great question. They are not covered by insurance.
Now, Michele, I totally understand your different tiers of pricing, $225 an hour being the highest. Now, a lot of different hospitals and maybe advocacy groups have patient advocates. How are you different from them?
Absolutely. Great question again, Kim. So how we are different is primarily our priorities and what drives us and our interest, our motives. So for an actual independent patient advocate, which that's who I am, our priority is our client or a patient, however you want to say it, and their well-being. If you work with patient advocates in either a hospital setting or an insurance setting, I'm sorry to say, but their motives, their interest is not always in the patient or the client's best interest, sadly.
I get it. You're independent, and that really makes all the difference, though, because you have 100% the patient's best interest in mind.
Absolutely, 100%.
Now, I know you're working hard for $225 per hour. So do you have an intake form when somebody comes to you and they want to get started? Or is everything done right there at that first hour of consultation?
So how this works is, so I'll back up a step. Say somebody comes to my website, they visit my website, and which is just my name together, which is hopehealthadvocacy.com. And they can go to the work with me button. At that point, if they can't quite figure out which path to take with me, whether it's the 10-minute, the 30-minute, or the one-on-one hourly package, there's a form on there that they can fill out and tell me a little bit about their scenario, and I can help them pick whichever pathway would be appropriate for them. So I wanted to say that. Then to your question about the one-on-one client, we get, yes, so that first hour we get into real detailed, like what's going on. I have to have a really good understanding of what's going, their where they stand, where we need to go. And at that point, I send them 4 forms that they have to fill out. So it's kind of like an agreement with, the patient and I that protects both of us. So it tells kind of what I can do for them, what I won't do for them. It talks about HIPAA and all that other stuff. There's also a form to fill out, like almost as I like to describe it, as if they're going to be a new patient in a doctor's office. I get a very detailed of their medical history, their prescription history, and the whole 9 yards, just so that I have all of the information I need. And I do like to, and I'll side note this really quickly, I like to say the more knowledge they give me, the better. If I'm to be successful for them, they need to give me, full disclosure of the information. I tell them the more information they give me, the more complete the information, the better I will be able to work for them and the better their results will be.
Well said. That's important to know because I think they need to put some effort into it in order for you to put your best effort into it.
Absolutely.
Now, I've got to ask a pharmacist entrepreneur type question. How'd you learn how to put all this together? Packages, intake forms, all the things, because you and me are about the same age. We both graduated in 2001, right?
Yes.
They didn't teach this in pharmacy school. How'd you learn all this stuff?
I had a pharmacist who I ran into on LinkedIn, and she actually had a course. She's actually been an advocate for, I don't want to misspeak, multiple years. And she had offered a course, and that got me started into a wonderful direction. And of course, just learning as I go, like I'm learning as I go, Kim. Honestly, that's really what I'm doing. Learning as I go.
How'd you get over the fear of, oh man, I'm not going to do this perfect and I should probably wait until it's all perfect, right? How'd you get over the pharmacist perfectionism and just get started?
Because I said, if you really want to do what I feel divine, like I feel like my divine purpose is to help others, that I felt so driven by that like I had no other choice. I just kept taking that first step. And I said, you know what? Take that first step. The next one will reveal for itself. And that's how I have done that. And believe me, Kim, it's not been a perfect road. I have some times where, like you said, I still think, oh my gosh, this isn't completely a black and white area. It's completely gray. But I just I just work on it. I work on it. I do some mind work and that kind of stuff just to continue to work on those type of things that surface as I go.
Congratulations on getting over the perfectionism and getting started and having a service in mind, but then pivoting and accepting others. I see a lot of great things going on for you, and I really appreciate your advocacy.
Thank you so much, Kim. I thank you for allowing me to have a voice today and on your podcast. I'm honored.
Well, yeah, thank you for sharing how you use your voice here. And we started off talking about being neighbors. So I've got to ask you, I'm in Ohio, you're in Pennsylvania. You were talking about doing about 90% of your work remotely. Do you only serve patients in Pennsylvania?
I do not. I am nationwide. So I have a fun little map that my sister Lynn bought me, and it's on my wall. And my vision is to penetrate every state in the United States. And so
nice.
I have several states. I have a pin in several states, but I still have room to grow, Kim. Look out.
That's awesome. Well, hey, it's great that there's no limit to what you can do. A lot of pharmacists have limits, with what they can do within a certain state. Now, as a patient advocate, are you able to go outside the boundaries of Pennsylvania? Is it because you're a patient advocate?
Great question. So how I protect myself, because obviously I always want to protect my pharmacist license, is in my agreement, I'm very clear that I'm licensed in Ohio, Pennsylvania, and Maryland. And outside of those states, they kind of have to take my advice with a quote unquote grain of salt. However, as we know, the advice is solid advice. It's just a matter of protecting my licensure. And if I do get pulled into more of a pharmacist client relationship, I do have to be careful.
Right? You've got to have boundaries, right?
Absolutely.
And that's part of being an entrepreneur. You have to know what you do and what you don't do. And sometimes you have to turn patients away or clients. You have to turn clients away. Yeah. Can you tell me a
Absolutely.
story about when you had to turn somebody away?
Yes. And it breaks my heart when I have to. But really, it was a client who she herself navigated the medical insurance. It had to do with a client who, well, I shouldn't even call them a client because they end up not being a client. But it was a wife calling for her husband, and he didn't have insurance at the time, and he was had all kinds of surgery. Something happened to him, and they were trying to dispute the hospital bill because they felt that they elevated the price of these things because he didn't have insurance. Like, they were very upset and thought that they were overcharged and those kind of things. And she had already set up a billing part of an orthopedic practice. And so she already had done so many things and I said, you know what, at this point, I don't really have any good advice for you to what other steps I would have taken. So at this point, and you know probably more than me in this area. So I just said, I don't at this point think I would be doing a disservice to you if I took your husband on. So now I did give her a few resources because I always like to, that's one thing, Kim, if it's something that is outside of my wheelhouse, that I'm working very hard at getting a list of resources that, hey, Michelle's not your gal, but I have X, Y, and Z. They are. So that way it's not like, okay, stop and that's it. I'm now giving you a solid resource that you can go to after, you've exhausted myself. That was probably one example. And to that point, I just want to really plead to out loud that don't wait too long to engage a patient advocate. I can't stress that enough. There's been several times that, they've tried so much and I'm like, if you would have just called me a step before or two steps before, your direction could have changed. So don't wait too late to engage a patient advocate.
That's good advice for pharmacists who take care of everybody else before they take care of themselves. We can even if we're not our own patient advocate, we can reach out to people like you for that help, because you were mentioning earlier with that higher tier, these are people that are busy and they care, but they just don't have time.
Absolutely.
For any pharmacists out there who are on fire about what you have talked about, they're like, man, I want to become a patient advocate too. What advice do you have for them?
Take the first step. Take that step. And if you listen to your intuition, I really believe your inside will tell you, you will get more signs that this is the path for you.
Thank you for sharing that. And do you recommend any books, websites, audiobooks, online courses, anything that would help somebody else and it meant so much to you that you want to share?
Absolutely. So I would say the patient advocacy organizations are very, very helpful. They actually allow you to, they have directories on there, so you can actually get business from them as well. So it's called APHA. They are one of the leading patient advocacy organizations. And I actually learned that from the course I took from that pharmacist. And they actually have how to launch your business. I think from 0 to 100 days or something. And I may have said that wrong. But they have a blog on there, and they have other means of connecting with other advocates that is helpful. So that I would say that would be networking is so important. And so, just networking with other advocates, they could even, interview. Like I'd be happy to speak with someone about what is really a day in the life of an advocate. And so I'd be willing to, anybody who wants to reach out to me to ask me something about what the journey really is and the good and the bad. And I'd be happy to be a resource as well.
Thank you for offering yourself as a resource. I'll be sure to put your LinkedIn link in the show notes so people can reach out and connect.
That's wonderful.
Michele, as we start to wrap this up, is there anything else you'd like to share?
Yes, I think two things. One is on the note of any other pharmacists who want to do this kind of work. I when I was putting my website together, I went over like what that nice little oath that we take as a pharmacist when we graduate. And part of that oath says, embrace and advocate for changes that improve patient care. And I truly believe that we all as pharmacists believe in that. And this is no better pathway to take to actually really be doing that. And the second thing is I want to end with a quote that's on my website as well. It's by Harriet Beecher Stowe. And it says, never give up, for that is just the place and time that the tide will turn. So don't lose hope. And wherever you are in your stuck journey in the healthcare world, reach out. And I'd be happy to help you turn the tide.
Thank you for sharing that. That's very insightful.
You're welcome.
And thank you for being here on the Pharmacist Voice podcast to share how you use your voice as an advocate. Thank you so much.
And thank you, Kim. It's been a delight.
Thanks again to Dr. Michele Mosier for being my guest on episode 216 of the Pharmacist Voice podcast. I'd like to share some final thoughts with you. If you've been curious about what a patient advocate does, I hope this episode's been informative for you. Every entrepreneur has their own unique story, and I enjoyed hearing how Dr. Michele Mosier used her strengths and her interests to become a patient advocate and start Hope Health Advocacy, LLC. Much respect to Michele and anyone who successfully lets go of that W-2 job and jumps into entrepreneurship. That takes planning and guts. Congrats. Entrepreneurship is not easy, as you heard. Michele had her share of challenges getting started, but she used resources, leaned on her network, and grew personally and professionally to get to where she is today. She knows which services she offers and what she charges. She knows her ideal client, and she can serve most of them remotely, which is really cool. She has the autonomy to look out for the patient's health and their bottom line instead of an employer's workflow or her employer's bottom line. She also loves what she does. What a great interview. We got to hear all about all of this. Now, after listening to Michele, I hope that you feel inspired to use your voice to share your strengths and your passions. There is power in having a voice and using it, so use your voice today. Let's wrap this up. Thank you for listening to the Pharmacist Voice Podcast, episode 216. Please visit thepharmacistvoice.com to read the show notes. In the show notes today, you'll find links to Dr. Michele Mosier on LinkedIn, Hope Health Advocacy's website, a link to the other APHA. Now, that's not the American Pharmacists Association. That is the Alliance of Professional Health Advocates. My social media links are also there, and more. Please reach out to Michele and me and connect. If you know someone who needs to hear this episode, maybe because they're interested in becoming a patient advocate as well, please share it with them. And if you like this podcast, please subscribe to or follow the Pharmacist Voice podcast on your favorite podcast player and YouTube to get each new episode right when it comes out. Next week, which is May 19th, 2023, is my spring 2023 update. I do seasonal updates. There will be 4 segments in that episode. First, I'll talk about what's new with my podcast. Second, I'll talk about my business, the Pharmacist Voice. I'll give you an update on that. Third, I'll give you news from my personal life, including my husband and the kids. And fourth and finally, just for fun, I'll give you an update on what I've been listening to, reading, watching, and playing. That is my favorite part. If you're new to my seasonal updates, let me just say real quick, my seasonal updates give you a way to get to know me better as a person. So join me next week for my spring 2023 update. Thanks for listening today. I'll talk to you next week.